Growing health concern among older adults, fragility fractures of the pelvis and hip are on the rise, raising a lot of concerns in hospitals and homes across the nation. Joining us this morning, Dr. Aleem Ramji, board-certified orthopedic trauma surgeon at the Hartford Healthcare Connecticut Orthopedic Institute. Doctor, thanks for being with us this Monday morning. And let me start with kind of the obvious question. What is osteoporosis and why are certain bones more affected than other bones?
Well, first of all, thanks again for having me. It's a real pleasure to be here. And so, to just back up, osteoporosis essentially just means that there is a disease process in the body where the bone mineral, the density of the bone mineral is depleting. There's a lot of different reasons for it. Aging is one of the most common reasons. But as our bone density declines, certain bones in our body become more susceptible to injuries. Again, people fall in very characteristic ways. We tend to land on our hips, we tend to land on our elbows, on our wrists, and we tend to see fractures in all the above groups.
Let me ask you about falls. You mentioned that. What can somebody do? What is the best way to try to protect themselves against having a fall? And when do you know if a fall is serious enough to really get in touch with a medical professional?
I think that's a wonderful question. It's a great question. Um, to me, every fall is serious and should involve some workup, whether that's involving going to your primary care physician or going to an actual orthopedic trained doctor. I think it's important to advocate for yourself. And one of those ways is to advocate for an x-ray. Certainly, the first thing you should do after a fall is ask for assistance, get help, get stable. And if you're able to walk after that, that's usually a really, really good sign that everything is okay. If you're unable to walk, unfortunately, I would get to an emergency room quicker, sooner rather than later, so we can get our films, we can get x-rays, and we can decide what the best treatment is for you.
Doctor, when do you know when surgery is required? And as people get older and older, I know surgery becomes a lot more touch and go. When is there a point when somebody's too old to safely have surgery?
So it's another great question. You know, surgery for us, we take it very, very seriously, and we only employ it when we feel that it is in the patient's best interests. Certainly, surgery comes with risks, the anesthesia, the actual surgery itself, the recovery. But we only go there if we feel that the body is unable to heal itself or get to a place where that person was before they fell. So one classic example is the hip fracture, one of the most common fractures in the community. And you can break your hip in a multitude of different ways. For us, there's only a few of them that we consider to be stable fractures, which we expect the body to be able to heal on its own. Most of them require some form of intervention because our goal is to have the person be able to fully weight bear and keep mobile. Because the last thing we want is someone laying in bed and deteriorating, as part of every trauma is a muscle deterioration. And so for us, getting the appropriate x-rays, getting the appropriate treatment, and then we can decide together, the patient and the provider, what the best plan is going forward.
Doctor, we only have about 30 seconds left, but I wanted to ask you real quickly, what is the best way to prevent the falls that tend to require these kind of surgeries?
It's a great question. I think it's all about doing weight-bearing exercise and testing your balance and starting now, starting yesterday, getting into a gym, eating healthy foods, maintaining your mobility. That does more for you than any medicine.
All right. Dr. Ramji, we appreciate the time. Thank you so much.
Thank you so much.
All right.